World Anesthesia Day is celebrated every year on 16th of October to mark the anniversary of the first public use of ether anesthesia for painless surgery by US dentist Dr. William T.G. Morton in the year 1846. At a time when a number of cardiac arrest cases have gone up to an alarming level due to stress and strain and other factors, citizens of the world can save lives by timely and simple medical intervention. With this aim in view, Indian Society of Anesthesiologists Guwahati City Branch organized a hands-on training program on compression-only life support for the common man on Wednesday, 16th of October 2019, coinciding with the World Anesthesia Day and World Restart a Heart Day. The program was held at Gold Gym in Guwahati.
10 and faster for Allah. 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Demonstrator of the life-saving training, Assistant Professor and Critical Care, Guwahati Medical College Hospital, Dr. Sanchita Sharma Borkotoki said the aim behind the hands-on training program is to teach every common man how to act in an emergency situation and become a lifesaver of a cardiac arrest victim. We have with us Dr. Sanchita, anesthetist. Let's hear from her what she has to say on this.
On the 16th of October in 1846, we had a hero in our line, W.T.G. Morton. On this special day, surgeries were started to be done in a painless way and in an unconscious. Patient was unconscious. Previously, patients were in a trauma. They were alive and with pain. So from this day, the whole thing has changed. And we are trying to improve it in our everyday life. To modernize the whole concept of anesthesiology, to make it safe for the public and everyone around us. On this special World Anesthesia Day, we also have an important World Heart Restart Day. On this special day, we have aimed to visit some of the gyms in our city so that we can keep the public safe. So we come to hear that there are some collapses in the gym, not very often, but sometimes. So each life is precious. So we have taken a step this year to visit some gyms. At this moment, I am in Gold Gym, Guwahati, Ganeshguri. So here we have with us a team who are demonstrating what is the basic way and what is the basic step we can keep a person alive till we have the medical personnel and an ambulance in the premises.
Well, what is the motive behind this? According to you, the World Anesthesia Day, so people should know, the common masses should be aware of how to do the pumping and all. The initial stage you have mentioned earlier. So what do you want to say on this?
See, previously, the concept of this is called basic life support. A person collapses and you have to do something to keep it alive till you get an ambulance. So first thing was always keep the breathing intact, but gradually researchers have gone and they have said that it is better to make the blood come into the body first. Start moving the blood, then you give oxygen. That is why now they have said that the cardiac compression, as we doctors say, what madam has said is heart pumping. Cardiac compression is the most vital step in keeping a patient or person alive till we get a medical help.
Anesthesiologist and consultant critical care of Name Care Hospital, Dr. Sultana Taslima Begum said, the common man can even save someone's life by knowing basic life-saving skills till medical assistance comes in.
First of all, when we get a patient or a person who is collapsing in front of us, anyone, and maybe a doctor or a lay person. So first we should just call for help first. First, we call for help for the 108 ambulance or any person who is well equipped with continuing with the medical treatment. So till then the person arrives or the help arrives, we have to continue with the simple measure of, as we have demonstrated today, about how to start compression and continue with it till the help arrives. Here we just have to have some simple technique how to make the patient safe. You be safe and the patient should be safe. Put him on a hard surface and just start compression with your bare hands. We don't need any instrument for that. So start off it and it just like continue the compressions because I won't go into details about the compression, we'll showing it there. So we just continue with 30 compressions and then continue it for 5 cycles till your help arrives with the AED and the other equipments.
Demonstrating the compression method, consultant anesthesiologist and AHA instructor of Narayana Hospital, Dr. Surabhi Kalita Khanikar said, few seconds following a cardiac arrest is so vital to save a life, and the best way is to learn fundamentals of resuscitation by every conscious citizen.
I think it is very much essential for each and every citizen of our country to know compressions, because this is I think the most priceless skill one can earn, because with only 2 hands, with our bare hands, without having any equipment in your hand, you can save the life of your near and dear ones. So learning this technique is of utmost importance, and we are here because we want to bring this resuscitation science to life. Our motto is to have healthy heart and healthy brain for common people. We want people to experience their best moments in life in a healthy way. So we want to show them what is the correct technique of compression, and we want to tell them the value of time after a cardiac arrest, because as soon as a person becomes collapsed or he becomes unconscious, every second counts. And in a country like ours, where there is a large population and there is heavy traffic on the streets, it is impossible to reach the hospital within 10 minutes. It is almost impossible. So each second counts after a cardiac arrest, so we have to start chest compressions within 10 seconds to get the best outcome, so that the person comes back to life or the heart restarts again. So this restart time is actually possible to bring it down to less than 10 minutes. After the person this heart is stopped, we can restart the heart in less than 10 minutes only if we start chest compressions within 10 seconds of cardiac arrest. That's why in this 10 seconds to act, each and every citizen must learn this skill of chest compression. Only then that is possible.
So what are the steps being taken to avoid the compromises?
Okay, so because we anesthesiologists are giving utmost or paramount importance in resuscitation among all the specialities in medical sciences, so we have taken a program, even we started this program called Calls or Compression Only Life Support even last year, and we are continuing it this year, and we are targeting the most vulnerable places, for instance fitness centers, because we have seen numerous incidences not only among the masses but also among doctors who have collapsed in the gym and has had major cardiovascular accidents and cardiac arrests. So we have to spread this awareness to the fitness centers and centers like sports, where sports activities goes on, because these are the centers in which very vulnerable incidences have occurred in the past, because we know that fitness is good for health, but at the same time it can be also devastating, because at that time when you are into a sports, your heart rate increases, you sweat, your sympathetic activity is at the maximum. So that is the time when you have to be of utmost, you have to have safety also, along with beating your body or taxing your body with the exercise.
But do you have any idea whether the Department of Health, the Government of Assam is taking such steps for making the people aware?
Well, as of now, I am in doubt, but yes, the Government of Assam has taken up a task of training up the ambulance drivers of the 108 ambulance vans with BLS technique, because we are one of the fortunate states in India who has an emergency response system. So as soon as a person collapses, you have to start CPR, but at the same time you have to activate the emergency response system, that is dial the 108 number. That is a facility we have in our state, and yes, the state government has taken that responsibility of training the ambulance drivers in basic life support. So we have a added advantage.
What exactly the steps to follow once you see a person who has suddenly lost consciousness in front of you? Okay, so suppose this is the person who has suddenly lost consciousness. The first thing you will do is safety of the person as well as yourself. So scene safety is the first and foremost priority. So you don't yourself want to become a victim, isn't it? So suppose this happens on the road, then you have to bring the person to a side pavement. You cannot take the person to the hospital because it will be too late to start CPR. As I told you, every second counts. So you have to initiate compressions within the first 10 seconds. So quickly shift the patient to the pavement, okay, and it has to be a firm, flat surface. Okay, firm, flat surface, because if you are placing the person on a bouncing mattress, all your effort that you're going to give while compressing is going to go in vain, because it will just transmit the force downwards into the bouncing mattress. So that force will not go into the person, because it is a very mechanically tiring job to give compressions. Okay, because you have to press how much? 1/3 of the diameter of the anterior posterior diameter of the chest, which is at least 5 centimeters, but not more than 6 centimeters. So that is quite a big depth, okay, especially in a muscular person. So next, you have to shout, tap the shoulders and ask, hello, are you okay? Okay, so this is checking responsiveness. If the patient is unresponsive, next you will shout for help or activate the emergency response system. So we are lucky in that in Guwahati we have got a number. What is that? The emergency van number? All of you know? 108. So that is the emergency response number. Or if you have number of any emergency around in your any hospital which is nearest to you, you have to activate that and get an AED, automated external defibrillator. So this is AED. I will be in details. I'll be speaking about the AED to you. Okay. So you have assessed responsiveness. You have activated the emergency response system, and you have gathered the AED. Suppose you have another person near you. Don't run yourself. Ask the second person to get the AED. If you don't have anybody, grab the AED if you have it, and then come back to the lay rescuer. Nowadays it is said that this AED should be there in all public places where there is a possibility of cardiac arrest, like fitness centers, sports activity centers, airports, malls, even residential areas, okay, swimming pools. So these are by guidelines. They have to have these AEDs, because AEDs are very, very easy to handle and can be handled or operated by even lay rescuers. Okay. So once you grab the AED, you can come back to the person, and then you quickly, within 10 seconds, you assess simultaneously for breath and pulse. First, you have to quickly scan for breath. Okay, for breathing, you have to just lie down and check at the same level whether there is any rise and fall of the chest wall. And if there is no breathing, then you will quickly look for a central pulse, which is the carotid pulse. Okay, why this pulse? Because out of all the central pulse, this is easily accessible. How to check for the carotid pulse? Put your fingers in the midline and just insinuate to the groove lateral to the midline. Okay, lateral to the.
Yeah, feel that
You can feel your just two fingers, with 2 fingers, first and the second one, just feel your trachea, the rings, and slightly you slide away laterally.
You can feel
you
your
will
own
feel
body.
your own carotid
Come to
pulse.
the middle, lateral, and you can feel your major pulse.
Okay, so you feel the pulse. If there is no pulse, then immediately start CPR. There are three possibilities now. The possibility number one, person is unconscious, there is pulse, there is respiration. What you will do? Do nothing, just monitor till the activated emergency response system has arrived. Okay. Second option, there is pulse but there is no breathing. No need to start CPR, and in pulse you just omit that part because then we give only rescue breathing. Okay, now come to the third scenario in which there is only gasping, no normal breathing, but there is no pulse. This is a firm and hard surface where the patient, you are placing the patient. Next, you will stand on the side of the patient.
Either right or left.
Either right or left.
And
then you will have to place.
Don't forget about the hard surface. Because if the patient is bent, it's better the patient should be in the floor. Any hard surface. And if it's too high above also, you won't be able to give. So it's better like the patient should be at the level of your hip joint. So whenever it's in the floor, then it's better to kneel down and do it. This is the best part. Like you can just kneel on your nail, and even the roads, and also bring the patient to the side and then start CPR. First of all, as she had mentioned, check for response. No? You have to check for response. Carotid pulse, again I tell you, she also mentioned that you don't waste time filling for the pulse, because it's very difficult for even us also doctors. We don't get pulse here, so we have the monitors and all these things. But so just see whether the patient is responding. You can feel the breaths, like you can see the breath, if the patient is inspiring or not, or respiration is there or not. But don't make confused with the gasping breath. Yes, you know, everyone knows gasping breath, na? They take a breath, but it's not normal. When you see it appears to be normal. So it's almost like no breath. So
it's
no response,
slow breath,
no
actually,
breath,
and doesn't come at regular intervals.
It comes
in sudden.
one comes. Like
It's a very forceful intake of air, which comes at a very irregular and slow interval.
It's called gasping breath, but that is as a no breath. So no breath, no response, no response. Otherwise, if you is a conscious patient and if you go start CPR, you'll get a nice slap. So it's a dangerous for person. Even that happens in our hospitals also sometimes.
I want to demonstrate a very important device which we use in the resuscitation of a person who has had a cardiac arrest. This is called the AED, or Automated External Defibrillator. It is a very handy device, and the best part of this device is it is very simple to use and can be used by lay person in any public place. So we have some programs called public access defibrillation. Under these programs, we make sure that we make aware to the public that these devices are to be kept in all public places like fitness centers, airports, malls, railway stations, etc. So that whenever there is a cardiac arrest, people immediately can get hold of an AED to save the life of a person. So the best part of an AED, it is very simple to use because it is a computerized device, and it can be used by any lay person because it gives certain instructions, and we just have to go on following the instructions. So it has got a battery. The first step is we house the battery at the behind of this device.
Plug in pads connector.
So as soon as the battery is housed, it starts giving you instructions. First is to plug in.
Remove clothes from patient's chest. Press pads firmly to patient's bare skin.
So this
Be sure the pad
device
connector
So this device will go on giving instructions one after the other how we need to give the shock to the patient. So as soon as the heart stops or heart starts to quiver, we need to defibrillate the patient in certain rhythms. So that decision is made by the automated external defibrillator. These are called the defibrillation pads, and there are markings about the placement. So in this mannequin, I am demonstrating the positions of the pads, AED pads. One pad is just placed below the right clavicle, and the other pad is placed in the mid axillary line, and this upper border of the pad should come at the level of the nipple. This upper border has to come at the level of the nipple in the midline of the axillary area, and the first pad should be placed just below the right clavicle. So this is the universal position of placing AED pads in adults.
With this hands-on demonstration, we have learned that these simple and effective procedures can save many lives, and we do hope that common masses take matters into their hands when time comes before a life is lost.